town hall is a short presentation by our presenter, who I'll introduce in a moment. But mostly we want to address questions that you as the audience will have or may have. And the way you do that is by going to the chat and asking questions. I will read your questions in an anonymous fashion, so that you don't have to be concerned if you don't want your name, but your question will be addressed to our presenter as well as our panel that I will also introduce. Okay, so let me introduce first of all, our presenter, who is Diana Perez, and she is hi, Diana.
Hello.
And she is a board-certified pediatric nurse practitioner. She's also the manager in the School Health Clinical Services, and she's affiliated as I am with NYU Langone. She's in the family health centers and their school health program. She's also in the Clinical Institute and preceptor for pediatric nurse practitioners and students. And of course, she's a faculty member at the NYU Grossman School of Medicine and the School of Nursing. So she'll be leading us through the paths. But in addition to Diana, we also have some researchers and experts in science that can also help to answer your questions. So I'll introduce first Dr. Weitzman, if he can appear magically. Okay. Dr. Weitzman, thank you. So Dr. Weitzman is also from the NYU School of Medicine. He's a professor of pediatrics and environmental health at the NYU Grossman School of Medicine. He's also a professor in the NYU College of Global Public Health. He is, as I said, he's a pediatrician, and he's served on many boards. And his focus has always been throughout his career to work on environmental influences of child health, child development, and child education. Thank you, Dr. Weitzman. Another panel member that we have is Dr. George Thurston. Dr. Thurston, are you with us?
Yes, hi.
Thank you. Dr. Thurston is an air pollution epidemiologist. He's world renowned in his field, and he works with, as I said, air pollution, and he's a professor in the Department of Environmental Medicine, as well as in the Department of Population Health at the Grossman School of Medicine. Terry Gordon, he'll appear in a moment. Dr. Gordon is also in the Department of Environmental Medicine at the NYU Grossman School of Medicine, and he is an air pollution toxicologist, and he works both with indoor and outdoor pollution. And if you have any questions that you think are more geared towards our panel, please feel free to put them in the chat, and our panel will be excited to answer. Okay, at this point, I'm going to turn it over to Diana, and thank you very much.
Thank you everyone for joining us for this Q&A session as we discuss with students and parents and our panel how to return to school safely. Many of the recommendations, or rather the questions I'm going to be discussing, were decided based on questions that were submitted from the community, from parents and from students. And will include mask distancing, ventilation, and hand washing and disinfection. Many of the recommendations discussed this evening will come from the American Academy of Pediatrics, which is the largest professional organization in the world for pediatrics, the Center for Disease Control, which is a federal agency. So the question is it safe for parents to send children back to school? And that is a very good question indeed, and one that does not have a one-size-fits-all answer. So what we will try to do is provide guidance on how to prepare children to safely return to school. Parents should consult with their child's primary care provider, their pediatrician or nurse practitioner, to assist them in making the best decision for their child. As COVID is community spread, the schools are a representation of the community. If the school is in a low COVID area, then there's less risk than schools that are located in a high risk COVID area. And we are extremely fortunate in that this area of the country, this region of the country, we have some of the lowest rates in the United States. Parents, you should check with your local community as an indicator of how to go back to school. And people who are in the red zone should be very cautious when thinking about returning to school, in-person school learning. The New York Times has an online resource which provides daily COVID information, which can be researched by state, county, or zip code. Or you can check with your local Department of Health for what's happening within your community. Again, the decision ultimately remains with the parent as to whether or not to return their child to in-person learning. The American Academy of Pediatrics strongly advocates that all policy considerations for this coming school year should start with the goal of having students physically present in school. And although they advocate for it, there is widespread circulation in many areas, which may not permit for in-person learning to be safely accomplished in many jurisdictions. Again, we are in very good shape in this area of the country right now at this present time. The importance of in-person learning is well documented, and there already is evidence that there have been negative impacts on children because of school closures during the spring of 2020. Lengthy time away from school and associated interruption of supportive services often does result in social isolation, making it difficult for schools to identify and to address important learning deficits, as well as child and adolescent physical, sexual, or emotional abuse, substance use, depression, and even suicidal ideation. This in turn does place children and adolescents at a considerable risk for morbidity and in some cases mortality. And beyond the educational impact and the social impact of school closures, there's also been a substantial impact on food security and physical activity for children and for families. And I do want to point out the disproportionate impact that this has had on Black, Latino, and Native American, Alaskan Native children and adolescents. So school districts, they have a responsibility to stay in close communication and to coordinate with local and state public health authorities, along with school nurses, local pediatric practitioners, and other medical experts. NYU Langone's Family Health Center's school health program, we're committed to doing the same in terms of continuing communication with parents and with students. And we will do everything possible to encourage parents and students to provide us with feedback so that they're actively involved with us, and we make changes accordingly. So is it safe for parents to send children back to school? Many schools, if not all, are responsible for distributing personal protective equipment for students and staff to use while they're inside of schools and school buildings. Students will be able to and should bring their own face coverings, but if for any reason they present to a school without one, face coverings will be provided by schools. And there are certain staff members that will require more personal protective equipment because of the population that they work with. So vulnerable populations, special considerations and accommodations must be taken and, to account for vulnerable populations, including those who are medically fragile or complex, live in poverty, have developmental challenges, or have disabilities, again, with the goal being for them safely to return to school. And children who have customized learning plans or individualized educational plans should not immediately be excluded from school. In fact, they should be included, and special accommodations should be made for each child depending on their need. It has to be a shared decision-making that will involve the parents, the healthcare provider, and the school staff. And people all over the world right now are facing the same problem, and all over this country, which is how to go forward in that area. So shared partnership is vital. It's so very important, where parents are involved, healthcare providers, and school administrators or teachers. I'd like to move to a question. A question that was sent in is it safe for parents to send their children to school? Should I get a thermometer? And the answer is yes. Parents should have a thermometer at home. Safety screenings, temperature screenings should be performed first thing in the morning before getting your child ready for in-person learning. That's very important. If your child has a fever, your child should stay home. And that's something that you want to identify before you even leave your home, to protect your child and keep your child safe along with everyone else. So we received a bunch of questions related to masking, so I want to go ahead and dig in. Masks are necessary, a very necessary intervention for children safely returning to school. So the question is, when should we help our kids with masks so that they can become accustomed or get used to wearing masks? And the answer is now. Masks help prevent people who have COVID-19 from spreading it to others. It decreases the amount of germs that are spread, and it protects others, the wearer as well. Please keep in mind that people who do not have symptoms also spread the virus. So it's important that we protect ourselves and others by wearing a mask. And schools should have face coverings and masks available for children and for faculty. So who should wear a mask? Well, everyone should wear a mask with a few exceptions. The Center for Disease Control recommends all people 2 and older wear a mask. Caregivers of people, if you're caring for someone with COVID-19, you should wear a mask. There are some people who think that possibly they could have COVID-19 should wear a mask. Now, there are some exceptions. Who should not wear a mask? Children younger than 2 years of age, anyone who has trouble breathing, anyone who's unconscious, incapacitated, or unable to remove the mask without assistance. In some situations, wearing a mask may exacerbate or worsen a physical or mental health condition, lead to a medical emergency, or introduce significant safety concerns. So people that are hearing impaired, deaf, or hard of hearing, or those who care for, interact with children who are deaf or hard of hearing, should consider wearing a clear mask. There are masks that have a clear area over the mouth so that they're able to read lips. If a clear mask is not available, you should consider communicating with your child with written communication or closed captioning. And really to try to decrease background noise, which will make it a little bit easier to hear. It makes it a little bit easier to hear, even if you're not hearing impaired and trying to communicate with masks. Often I find myself not being able to hear people. Children with intellectual and developmental disabilities, mental health conditions, or other sensory sensitivities, they may have a challenge wearing a mask. It may be challenging for them and uncomfortable. And you should consult with your healthcare provider if they fall into any of those categories so that they could best guide you as to how to proceed. Younger children, preschool and elementary age, they may have a difficult time wearing a mask for a prolonged period of time. So you really want to work with them. I need you, parents and students, make sure you wear masks that are the right size. That's very, very important. Often I see people wearing masks that are not the right size. And if they're not, then they're not going to provide the protection that is needed. And it defeats the whole point of wearing a mask. So a mask should cover your nose and your chin. You want to make sure that a mask fits well. A mask should not be worn like this or like that or like this. It's very important to wear a mask correctly so that they will help to keep you safe while you're at school, students, and your children safe while they're at school. So they do come in different sizes. It's important to wear the correct size mask. People shouldn't wear a mask if you're engaging in activities where you're going to get wet. If you're going to a swimming class, you should not wear a mask because a wet mask will make it very difficult for you to breathe. And children, students who engage in high intensity activities like running, they may not be able to wear a mask because it could cause difficulty breathing. I want to stop for a moment and an important point to make. Masks that you should not wear are masks with exhalation valves or vents. So some masks have an exhalation valve or a vent on the sides. Usually it's one side. And the purpose of those masks is really to keep the droplets from reaching the purpose of masks altogether is protection, and the valve or vent mask cause actually the droplets to get expelled or to come out of the mask. So it defeats the purpose. So please stop wearing and don't wear masks with valves or vents, because it defeats the whole purpose of the protection that masks are supposed to provide. So the Center for Disease Control, they do not recommend masks with vents. Cotton masks are fine. Children may become very fearful about wearing masks and not understand what's happening, especially if they don't understand. And so if your child is hesitant to wear a mask, the Center for Disease Control says that a cloth covering works just as well. So if they do not want to wear a surgical mask, that is okay. You could make your own mask using a t-shirt or a bandana. And you want to make sure that you get your child involved and make it a fun process, not something that you're just handing to them. Allow them to decorate it so that they're involved. Allow them to pick the color whenever possible. But everyone must wear face coverings at all times. And remember, your nose and mouth should be completely covered. Looks like we have questions, Judy.
Yes, we do. Thank you. And thank you to those who have written. So we have a question. Sunset Park, Brooklyn currently has 6.9%. Do you think it's safe at that level for children to go back to school?
So I believe the criteria for first of all, closing schools is 7 or higher over a period of a week. Any of my colleagues could chime in if you know the numbers. But based on the current numbers, it is safe for children to return to school as long as they adhere to what we've already started talking about and the other things that we will start to talk about.
I'll ask any of the other panelists if they want to add something briefly. Okay, thank you. We have another question. The DOE's reopening plans have students eating lunch in the classrooms, unmasked of course, while teachers are providing instruction. How is this safe for the teacher and the students?
So that's a very good question, thank you. So the goal, one of the goals that the DOE has is to keep children in the same classroom. So you have the same group of children in the classroom at the same time for the entire day. And so what that does, and that's often referred to as cohorting children, is it keeps them in one environment, which will decrease their risk for being exposed to other children, adults, and germs. And so keeping them in the same room all day is safer than having them move about the building. And tied to eating, it's safer for them to eat in that room because it's the same group of people together, as opposed to going to a cafeteria where you're exposed to more people. So keeping them together decreases their risk for infection.
Okay, I think that's it for the questions right now. So Diana, back to you.
Sure. I'm just going to finish up with masks. So please remember that if you do use a cotton mask, a face covering, that it's important to wash it if it's soiled or if it's wet, and you can throw it in the washer with a little bit of laundry detergent and use the warmest setting possible. If you want to clean a cotton covering, you can do so by using a bleach solution, and you can look at the Center for Disease Control's website to find the formula for that. So if you don't want to get to the laundry, you can clean it at home. But beware of certain bleaches that are specifically for cleaning colors, because they do not contain disinfectants. You want to make sure that you read the label whenever you use bleach as a disinfectant, because not all bleaches contain disinfectant. So again, I just to sort of summarize, children need to be involved in decorating their masks. Practice wearing a mask with them now before they get to school. You could make it into a game, but also you should make it into a rule. So the rule book is a game that becomes a rule that's a game that keeps you safe, if you will, because it's super important for them to get used to it. This is one of the rules that we must follow in society. And so children need to see parents role modeling, and we need to wear our masks so that our children can see us doing that as well, and it becomes part of what is normal for them. We are role models for our children, the best role models. They will see school faculty wearing it, masks when they go into school, as well as school-based health clinic workers. Try to make it fun. You can create a game like who can wear the mask the longest, and then maybe give a prize such as a sticker or a privilege. You could also have them just wear a mask during one show, just so that they can get used to one TV show, just so they can get used to the feeling of wearing a mask. So a question that we received was, how should I safely walk in halls, and do I need a mask to walk in halls? Yes, you do need a mask to walk in up and down the hallways. Masks should be worn at all time in school buildings and outside of school buildings as well. And the way that you can safely do that is by maintaining social distancing, which means staying 6 feet apart from someone. So what does 6 feet mean? That was a question we also received. 6 feet apart from someone is like putting two very large dogs side by side. And so that's 6 feet. Another way to think about it is two large shopping carts side by side would be considered 6 feet, just to help you to get a sense of what 6 feet actually means. Schools will have markers on the floor, so you have a good idea and that of what 6 feet looks like, and also in terms of social distancing. And we'll have posters and tape throughout the buildings, so that will assist both students and adults with understanding what 6 feet really means. Another question is, does that mean that I cannot get up close and personal with my friends in the hallways? So even if you wear your mask, you really shouldn't get up close and personal with your friends in the hallways. You definitely can socialize and talk and chat, but you need to maintain that 6 feet to protect yourself along with wearing your mask. Another question, what if someone is going up the down arrow or vice versa? How do I stay safe? Wear your mask. The answer is wear your mask and maintain social distancing. Keep that 6 feet apart from your friends.
Okay.
So
I have a few questions for you.
Okay.
Is now a good time?
Yes, thank you.
Thank you again. There are lots of questions coming in.
Oh, sure.
If students are sitting in socially distanced rows facing the front of the classroom, where in the classroom is it safe for the teacher to stand or walk?
So because classrooms are set up in a way that promotes social distancing, and children and teachers will be wearing masks and any other personal protective equipment that is necessary based on their situation. Everything should be spaced out in a way where the teacher is able to teach. Typically, it's from the front of the room, but they should be able to maneuver through the room safely if everybody is adhering to protocol, the protocol of wearing a mask, social distancing, and hand washing. Very, very important. There are other things that will reduce the amount of germs that we normally have in a classroom pre-COVID, such as high-touch surfaces, doors. One of the things that will be done is we want to decrease the amount of times people are touching door handles and opening and closing doors. So in some classrooms, the door may remain open the entire time. In other classrooms, the door may, it depends, it may vary from classroom to classroom, school to school. The door may remain open until everybody enters and then close. And then that person, whoever closes the door, probably a faculty member, will go ahead and clean their hands. So hand washing or hand sanitizing, super important, along with social distancing and masking. And again, the physical environment being set up in a safe manner.
And again, any of the panelists, if you feel you want to add something, please feel free.
Ventilation is also something that schools are looking at. Some schools have a ventilation system, older schools do not. And so ventilation will consist of opening windows and airing out the building. So that's another way. I just wanted to add that, that teachers and children will be able to safely maneuver through the room or walk through the room.
Dr. Thurston, Dr. Gordon, do you want to add anything on ventilation?
Well, yes, I agree that ventilation is helpful. In days past, one of the sayings was always the solution to pollution is dilution. And I think that's true indoors as well, that the more ventilation there is, the more it will dilute the virus and any other pollution that's in the indoors. So that having extra ventilation would help.
Thank you. Dr. Gordon, do you want to add anything, or should we go to the next question?
The more, the better. That's all.
Okay, thank you. Another question is, Normally, teachers circulate, lean over, and check students' work, but that violates social distancing requirements. How do we get through this?
That's a very good question. I think we definitely live in a new world, experiencing different, things that were normal differently. So I think that teachers are going to come up with creative ways and have already come up with creative ways to handle giving out paperwork and returning papers. We're living in a new world where we need to be creative, and they will be.
Okay, thank you. Can I ask you a few more questions, Diana,
Sure,
or would you
please.
like to move on?
Yes.
Okay. What's the difference between cleaning and disinfecting?
So cleaning decreases, cleaning is like what you would do with soap and water, and basically it decreases the amount of germs that's on something, whereas disinfecting will actually get rid of the germs. And it's recommended that you clean first, get rid of whatever is an object is soiled with, or if it's not visibly soiled, you should clean with soap and water so that it really optimizes the use of a disinfectant on whatever it is that you're cleaning.
Okay, I was just going to add to that we have a number of infographics that if you write on the chat that you'd like some infographics on the differences between cleaning products and disinfecting and antiseptics, please ask me on the chat and we'll be happy to send it to you. Please provide your email address as well. I'm going to ask this of both Diana and Dr. Weitzman. The flu season is expected to be particularly bad. Can someone have COVID-19 and the flu at the same time? Or are folks who contract the flu more susceptible to COVID or vice versa? So Diana and Dr. Weitzman.
You could have both influenza and COVID virus at the same time. You could have any two viruses at the same time. I'm sorry, can you repeat the second part of the question?
Sure, let me get back to it. Okay. Can someone have COVID-19 and the flu at the same time? I think you addressed that. Or are folks who contract the flu more susceptible to COVID or vice versa?
So anyone that's sick their immune system is compromised and they're more at risk or susceptible to getting something else, not just COVID, but any other virus. So it's important to adhere to wearing masks, hand washing, social distancing, and good ventilation if you're sick, and take good care of your body. Keep well hydrated, don't skip meals, and get good rest so your body can recover, and take good care of yourself, and stay home if you're sick.
Dr. Weitzman, do you want to add anything to that?
Sure. I think it's extremely important that all children be immunized against influenza. For all sorts of other diseases, we know that having influenza increases the likelihood of it being more severe. It doesn't increase the likelihood that the kids are going to get the COVID, but if they do get COVID and they have influenza, then it's likely that it's going to be more severe. And this is, it's important to get the flu shot as soon as possible. It lasts about 6 months. And there have been a number of states that have already reported cases of influenza. So the sooner the better.
Thank you. Okay, we'll move to the next question.
Judy, I just wanted
sure.
to say, I've also been told that that the symptoms of COVID and the flu can be similar. And so they really advise getting the flu vaccine even more so than usual to avoid having people think that they have COVID and then having to go out and get the test and having that scare. So they're saying, this year especially, everyone should get that flu virus, get the inoculation against flu to avoid that confusion.
And I'd like to add that the flu vaccine takes about 2 weeks to get into the body and provide protection. So it's very important to get immunized sooner rather than later.
Okay, thank you. Another question, this goes back to the eating. If the teacher is instructing during eating, isn't there a risk with droplets and unmasked children? I guess the answer to that again is social distancing.
Yes.
Okay. Two-ply mask was recommended.
And I'm
in other-
sorry, children, when children are eating, that's lunchtime, so there's not teaching that's occurring. So the teacher is not, I just want to make sure I answered that correctly and heard you correctly. So
Okay.
lunch break is lunch break, yeah.
So I think there was some confusion in the last question. So again, to emphasize that while they're eating, there is no instructing going on.
Correct.
So they're just eating. A two-ply mask was recommended. WHO, the World Health Organization, said age 2 to 5 should not wear a mask. What do you think? And I think you already addressed this, but please emphasize it.
Children 2 and older should wear face coverings and masks to reduce the risk of spreading COVID and getting COVID.
Question for Diana. What does the Department of Education say about safety on the bus?
So if there's any way possible not to travel by bus, that would be ideal, but that's not realistic for most people. Buses should have just a bus driver, and if there has to be a second person on a maitre d', that's fine. No other adults should be present on the bus. There should be markers on the bus. Ideally, the same students should sit in the same seats if they're traveling to school on bus. And really just maintaining of social distancing, windows open, well ventilated. Good ventilation is important for buses, as well as cleaning before and after. Daily cleaning of the bus and in between is needed.
Okay,
Children
so
should also wear masks while they're on the bus and practice good hand hygiene.
so we have a question from someone who said that the New York Mayor, Bill de Blasio, indicated that that schools can open there and remain open, but only if the positivity rate is below 3%. And that goes back to our question about Sunset Park. Do you want to?
So thank you for bringing that. Yes, thank you for raising that. That is correct. That's exactly correct. So Bill de Blasio has said that schools can open and remain open only if the positivity rate is below 3%. And I'm sorry, I don't know the present positivity rate. So I want to retract my response, the response that I gave earlier based on this information, and thank you.
So if you were to say that, then with Sunset Park being 6.9%, it seems that what the mayor is saying may not be a safe return. You want to comment on that?
That is correct. If that is the number, then based on what the mayor is recommending, then just following that criteria, it wouldn't be safe to return to school with a number of 6.9 if that is the number.
Please make sure, everyone out there listening, that you check those rates for Sunset Park, for Gowanus, for Red Hook, for North Brooklyn, that you check them on a regular basis, because hopefully the number in Sunset Park will come down. And we have a question following up about lunch. You said the group of students will be together throughout the whole day, which will make lunching in the classroom safe.
It will make it, I'm sorry, is that the question?
Yes. Will it make it safe? And will they be lunching in the cafeteria or in the classroom?
So the DOE has said that children will consume lunch in the classroom, not in the cafeteria, and it will make it safer. So it's safer for children to eat in the same classroom with their peers than them eating in a larger setting such as a cafeteria. So it's safer. Again, along with the other recommendations that we've made and that have been made. So hand washing, masks when they're not eating, and maintaining social distancing and ventilation. All of those things together make it safer for children to eat in a classroom as opposed to a larger setting such as a cafeteria.
Okay, so again, following up on that, high school teachers are seeing many different groups of students throughout the day. Can you give us more details about lunch and some detailed responses that may account for any nuances? So we have several questions on lunch, so maybe you can provide more details.
So lunch is going to be provided in all settings. I'm talking specifically now about the Department of Education in New York City. It will be provided to children regardless of whether they're in person or not. So I think it's important for parents and students to know that whether your child is in school or at home, you will be able to get meals from them, grab and go meals, so that they will be able to have that resource available. The second thing is that children will be allowed to bring their own lunch in if they choose to do so, regardless of age, or they will be offered school lunch as well. So those will be the different, I guess, options for meal choice. They will be consumed based on what I read, in the classroom for all ages. Would anyone on the panel like to add to this response or add to this question? Answer this question or add to it?
Yeah, it doesn't need to be for New York City because, as I said, we have a wide population,
Right.
but do you want to give an answer in general? Okay.
Could you please repeat the question, the specific question that you're asking?
Okay, well, we'll get down there. It's just that there are several questions concerning.
Okay, so I want to talk
lunch.
about the other settings. So just separate from the New York City Department of Education, other schools in other areas may decide to have lunch outside of the building. They may decide to have lunch in a cafeteria and decrease the number of, they would have to vastly decrease the number of students that are in the cafeteria. So those are other things that are being considered and likely will be done in other school districts.
Thank you.
Sure.
Okay, another question, up to what level of COVID-19? And I'm not sure how many cases the school should be at before it's closed. Has the mayor or the DOE in general or other states say that how many cases would you need before the schools close?
I think we, referenced earlier the positivity rate being 3% in New York City would make it 3% or more would make it unsafe for children to return to school, so schools would have to close. I can't speak to any other criteria, any other numbers that exist at this time.
Okay.
Yeah, I think that they may try and do like sub-cohort groups. In other words, if someone in a classroom has it, then they would quarantine that classroom. We don't know. It's going to vary from school to school and from school system to school system. But that is one way where the school would stay open, but the children in the same class would all be quarantined. And so that class would lose, however long, 10 days or whatever the time period they decide. So that's the way they may handle it rather than having entire schools shut down.
Okay. Diana, I'm going to ask you, we have about 3 or 4 more questions that I see right now. We also have 18 minutes or plus or minus 2 more minutes if we want to go a little bit further. How would you like more questions? I know you have other topics on safety that you planned on covering. How would you like to handle this?
I think I'd like to continue with questions. I think we're moving through the 4 areas that parents and students were interested in discussing.
Okay. Yeah. Okay, specific. A child has diarrhea in school. The parent is called to take the child home and go to the doctor. The mother wants to wait 24 hours to see if it's something else, like something the child ate and not really COVID. Is this okay? And especially since diarrhea is one of the new symptoms for COVID.
So, at the end of the day, it's the parent's decision to wait.
Mm-hmm.
The sooner ideally getting tested would be better because you as a parent would know sooner rather than later whether or not your child has COVID. Regardless, until your child is COVID tested, if it was recommended by the school, your child wouldn't be able to return to in-person learning until the result came in, and then a decision would be made based on the results. So I would say sooner rather than later would be better for your household, and so that you know what the next step is going to be and how to best manage your child and safely manage your child.
Dr. Weitzman, do you have anything to add?
No, I just entirely agree. Prior to COVID, there'd be no problem necessarily with waiting for a day or two, as long as the child was well hydrated. But in terms of tracing, whether it be within the school of kids who are exposed, or for vulnerable people in the household or the family, or other people who have come in contact with the child, the sooner you make the diagnosis, the better. It won't necessarily influence the health of the child who's affected, but it will have great implications for those who come in contact with the child.
Diana, you want to add anything, or should we move on to the next question?
Move on, thank you.
Thank you. Please note that there is instructions going on during lunch according to the DOE. And we have a teacher who's read them. And so if you would like to add anything as a teacher, please put it in the chat and we can make sure that everybody is aware of your knowledge and how you can share that. Thank you. In your opinion, do you think we should send our children to school? Do you think that COVID will increase when we send them back to school?
You know, I started off by saying that there's not a one size fits all answer. I think that there are a lot of things to consider as a parent. The schools are taking this seriously, are doing everything they can to create a safe environment for children and for teachers as well. Between social distancing, face coverings, good ventilation in school buildings, and hand washing and disinfecting, all of these things have been found to significantly decrease the risk for spread of infection. I think, you know, we do need to consider, I'm a parent as well, as a parent and educators and healthcare providers, the impact of not sending our children back to school and the negative effects that I discussed earlier, that I mentioned briefly earlier, that could occur if we continue to keep them out of school. Social isolation, anxiety, depression, there's a long list of possibilities. And they're not just possibilities, these are things that we're starting to see in children and are concerned about as healthcare providers and educators. So I think it's important to look at all of the information that is out there, look at the patterns where you live, the local patterns and the COVID activity, and to make sure that you make an informed decision that you're comfortable with at the end of the day, before you decide to whether or not you're going to, have your child return to school, to in-person learning.
Dr. Weitzman, do you have something you want to add?
And I agree with Judy. There's nothing more important and more difficult than being a parent, but it is your right and your responsibility to make a judgment on behalf of your child. It is extremely important to recognize just how important school is for kids' development, their social and emotional development. But many, many families have their own logistical issues that they shouldn't feel guilty about. There are lots of people who have to work, who need some place for their children to be. I also want to say something, and Diana, disagree with me if you do. I understand the profound concern about exposing our children, but children tend to get a much more milder form of this than do older people. And so when we talk about safety, it's a rare event for a child to get really sick with this. So the issue really is, will the child spread it to other people? But I get just how frightened parents are. Many of us are not going to be able to keep our kids at home forever. It's just not practical. So, but it is an individual family's decision, and it is one of the countless decisions and responsibilities that parents have to exercise and deal with over the course of a child's life. And it doesn't end when the child's not a child anymore.
Thank you.
Thank you, Dr. Weitzman. I agree with everything that you said.
So Diana, we're going to turn back to you because I don't see any other questions right now. So if there's anything additional you'd like to add?
Sure. I think it's very important for people to be familiar with this, to familiarize themselves with this. This is a face shield, and face shields are not recommended in place of a mask. Now, there are certain populations that may wear a face shield because like the hearing impaired. If someone is unable to wear a mask and has elected to wear a face shield, know that the Center for Disease Control does not recommend face shields, but if you're going to do it, please make sure that it covers completely. So it needs to cover completely the sides of the face and go past the chin. And again, I want to stress that these are not recommended. So if you see them, you're not missing out if you're not wearing one. You don't need to please don't run out and buy one. There is not a need. If you do use this and it's disposable, one-time use, please do that. Discard it after you use it one time. And if it's reusable, then you could look at the manufacturer's instructions for cleaning it. Everyone should wash their hands. It's super important to remember to wash or disinfect your hands before you wear a mask or a face covering. So we talked about social distancing and how important it is. I'm just gonna
interrupt one time. Dr.
Sure.
Weitzman has something you'd like to add? You raised your hand, Dr. Weitzman?
I actually, not at this particular point, Judy. That was
Okay.
a couple of questions ago.
Okay, thank you. Okay, I'm sorry, Diana, excuse me.
So social distancing, we've already started talking about, but schools are responsible for really creating plans and to support movement that upholds physical distancing while your child is in the school building. And some of the ways that they're doing that is with one-directional stairwells, single file travel patterns. If there is an elevator, that elevator will be restricted or limited just to individuals with special needs. Or if it's a high-rise building, it will be limited to the used only for the limited capacity to decrease the number of people that are in the actual elevator. And face coverings, again, I can't stress the importance, should be worn in every area of the school. The Center for Disease Control does recommend spacing out that 6 feet when feasible, and limiting the number of students in a room. Adults also maintaining distance is important. So again, earlier we had some questions related to teachers walking throughout the classroom, during instruction and also during consumption of lunch, eating lunch. And the goal is to maintain social distancing even within the classroom and to do so in a creative way. Schools will have directional markers and posters throughout the travel routes. And those routes should also be staffed appropriately so that children are helped along as needed so that they can maintain social distancing. The other thing is teachers will likely be moved from class to class when they need to, and I think that's going to be greatly limited. The goal is to keep them in the same class when possible. With the goal again being that students remain in one classroom as much as possible throughout the day so that we're limiting the amount of travel time children have during the school day and keeping children with the same cohort or group of children. Creating one-way hallways to reduce close contact. Again, tape on floors or keeping children in the classroom. Staggering class periods as well by cohort to limit the amount of movement in between classrooms. And utilizing public spaces. I know the mayor of New York City talked about utilizing public spaces for instruction. So that's something that will help when that's sorted out. We must limit unnecessary visitors into school buildings at all times whenever possible. And planned avoidance of close contact activities such as singing and exercising and band. Those activities are best left at home, not during in-person instruction. Eliminating use of lockers. So lockers in an ideal world will go away. Not all children can carry, we have to be realistic in terms of lockers as well. So there may be a need for lockers, and there may be children that have tons of books and they can't schlep around and walk around with them everywhere. And so if lockers are used, one of the ideas or one of the thoughts is that children should have the cohort or the class of children, the same class of children should have their lockers together so that they're not mingling with other children. And
Diana,
lockers-
can I interrupt you for a
Oh, yes,
moment?
please. Mhm.
I just want to clarify for people that this is largely an airborne disease. And so there's been lots of concern about surfaces, but it's much harder to get this from a surface. We're all filled with so much anxiety and so much uncertainty. But I do think that we need to recognize that it's much rarer to get this because you've touched something than you've come in contact with somebody not wearing a mask or haven't paid attention to the distance. Sorry for interrupting.
No, thank you. That's very, very important point.
Diana, we also have additional questions
Okay.
if you want. Okay, if you wear a medical mask, if you wear a medical mask, is it only a one-time use?
If it's a surgical mask, if it's a surgical mask, the person is referring to, that mask could be worn the same day. That mask could be worn for the day. If it's soiled or wet, it should be changed.
If it's not, can you continue to use it?
If it's not soiled or dirty or wet, yes, but you should clean mask. If you can clean a mask, you should clean. Actually, I'm sorry. So medical masks should not be cleaned by people. You should discard them if they're dirty, if they have lipstick, if they have makeup, if there's any sort of cream on it, or if they're soiled. They should be discarded. Otherwise, it's okay to use.
Okay, thank you. It seems like I have a lot that are going in the garbage. Okay, another question, and I'll remind you that we have about 5 minutes. So if you have questions, please get them on now so we can address them. What about picking up our, first of all, in response to the other one, yes, this participant was asking surgical masks, yes. So I think you've addressed that. I'm not sure what the question is here, so maybe someone can add to it, but it says, what about picking up our children at the end of the day of school? I'm not sure what the question is, but maybe you know, Diana.
So I think it's an important consideration. Thank you for raising it. So drop-off times and pickup times, one of the strategies that is being considered is that we should have staggered drop-off and pickup times to decrease the amount of people that are present at the school, in front of the school during dismissal and drop-off. And when people are picking up and dropping off the children, they should, as well adults, maintain social distancing to decrease the risk for infection.
Thank you. I don't see any additional questions, so if you'd like to continue for a couple more minutes, Diana.
Sure. So other safety measures that schools are taking are that they will conduct meetings whenever possible virtually. They're deliberately planning and continuing. This is not something new to have meetings virtually or outside of the building if possible. I was going to get to staggered drop-offs and pickups, so that was a great question at the right time. But again, parents, I can't emphasize the importance of parents being discouraged from entering the building. Physical barriers, you may see plexiglasses in some places, reception areas and employee workspaces within school to reduce the risk for infection. And then there will be no more congregating in shared spaces such as lounge areas. You won't see crowds of any school faculty doing that because again, our goal is to social distance and to decrease the risk for infection for everyone.
So I think George, Dr. Thurston raised his hand. Is that all right?
Yes, thank you.
Okay.
Put this there. Just to pick up on what Dr. Weitzman was saying, can you see that with no masks and talking about the aerosol and how it spreads from in the air, and this really brings home the importance of everyone wearing a mask. So that you're protecting yourself somewhat, but you're really protecting everyone around you, and it's much more effective if everyone participates in that.
That's excellent. That's an excellent visual that I think brings home everything that everyone has just talked about. So we have one minute. I'm going to encourage people again to send in any questions that they might have. If not, we're going to ask Diana to wrap up and then to address our panel to see if they have any last. Oh, wait, we have a question. Thank you. Since Dr. Weitzman shared that COVID is airborne, if a person is found positive, is it really safe to close only the classrooms where the person was identified as COVID positive?
Dr. Weitzman, would you like to answer this one?
This is Terry Gordon. I'd like to answer it.
Sure,
I'm sorry,
please.
Dr. Gordon.
I don't agree with Dr. Weitzman. I think there's very little data that gives the relative risk from airborne versus touching. I mean, there's just so little hard data there that I think what has been touched upon is by you, Diana, is everybody should take every precaution that they can and they feel comfortable with, and particularly that their child feels comfortable with or their students feel comfortable with. As George said, dilution is a solution to pollution, wearing masks, increased ventilation, washing hands, reusing masks once they're cleaned. All these steps should be followed because I don't think we really know which is more risk-taking than the other. I mean, probably inhalation route is the most risk-taking, but in my life, and I bet if we asked Dr. Weitzman, Thurston, and Zelikoff, we all do the same thing. We social distance and we wear masks and we wash our hands because we want to reduce our risk as much as possible. And I think we would want to do that for our students and for our children.
So may I add to that?
Let me just, one more, adding on to what Dr. Gordon said. So the question is, Dr. Gordon, is it really safe to close only the classrooms where the person was identified as COVID positive? What's your opinion on that, Dr. Gordon?
I mean, closed by just quarantining the students, that's one thing. Of course, they probably should be quarantined. I agree with that. As far as the room, I mean, to me, it seems fairly easy to clean a room. You know, the virus doesn't live more than several hours or a day or so, and there can be cleaning mechanisms to clean the room. So I don't see a problem with reusing that room, the kids coming back. As Dr. Weitzman said, there's a lesser risk from contamination and touching. So I think the room can be reopened if that was what the question's asking.
I think they also mean if someone is tested positive and you close off the classroom, that they were found in order to clean up and to disinfect, sanitize, or is it better if there's a student found positive to close the school or to close other classrooms? Is there, I think that's what the person was getting.
Oh, I think it was brought up earlier that it's probably sufficient to just close that particular classroom.
Okay. Dr. Weitzman, you wanted to add something before we close out?
Well, I'd like to add two things. One is that many schools are deciding to close around the country, not when one room gets it, but when it seems to be spreading to different groups of kids in different rooms. So that's something to keep in mind. But I'd like to add to a point that feeds off of something that Dr. Gordon just said, which is that there's a great deal of uncertainty and there's a lot of misinformation and there's a lot of miscommunication and there's a lot of people saying things that are not based upon evidence. Remember, this is only 6 months that we're into this. So it's important that parents stay in touch with school authorities, the health department, their own physician, nurses or nurse practitioners, and they need as much information as possible. And many people use the web, and there are lots of places that I wouldn't trust at all for information. So going to the Academy of Pediatrics website or CDC's website should provide parents with the most authoritative information that's currently available. That information is going to change regularly and very rapidly.
Thank you. I was going to add that as well, that You can see here that even scientists, everything is evolving, and it's evolving as we speak. Again, this is Judy Zelikoff, and I think the best thing we can all do is to pay attention to the legitimate sites, to, as mentioned, CDC, WHO. I think the governors, certain governors are doing excellent jobs, but make sure that you can discern between myth and reality and what's happening. I'm going to let everyone have a last word. Diana, I'm going to save you for last. So because you've done an excellent job of responding to the questions and you're the presenter. So I'm going to ask Dr. Thurston, Dr. Gordon, Dr. Weitzman, and I'd also like to introduce Simona Kwan, who is my co-director, co-lead with the Community Engagement Corps which is sponsoring this. We have other support by other places in NYU and the medical school, as I said, the faculty health centers, the schools, and she is the co-lead on this. So thank you, Simona. And so Dr. Thurston, do you have anything quickly that you'd like to add as a last point?
Well, I just want to repeat that people should try and get the latest science and follow the science, not some of these odd sources you get on the internet and places like that. Make sure that you go to the sites that Dr. Weitzman was talking about. Follow the science.
Thank you. Dr. Gordon?
Yeah, I agree with George, and I would caution that when you follow the science, unfortunately, it's become politicized. So CDC keeps changing their mind. And I'd probably use this, whatever CDC said at its strictest. Right now, I think the CDC says if you have symptoms, you don't need to get tested, which...
No, if you're asymptomatic. If you test positive, but you're asymptomatic.
No, if you've been exposed to somebody.
Okay, yes.
Okay.
Been
Right.
exposed and asymptomatic, you don't need to
You
get
can see
tested.
how hard it is to think this through
Yes.
and discuss it.
So use caution.
Use your common sense.
Yeah.
Dr. Weitzman?
We're all in this together, and these are unprecedented times. And we need empathy, and we need to communicate with each other. And we need to understand that any decision that we make is going to be based on imperfect information, but we want to do the very best that we can by our kids in all domains of what we call health. And that's physical and emotional, social, and cognitive.
Thank you. Ms. Perez, last word.
We as parents make a significant difference when we practice what we preach. So it's important that we wear masks, that we social distance, that we focus on hand washing, and that we are good role models for our children and for one another, so that the new normal is normal for our children and not something new. We can do this together. We are doing this together, and we need to continue to work together as a team. Thank you.
And I guess I just want to say one last thing, and that is Krina. I'd like to introduce Krina, who is my community engagement coordinator, and she's done a great job of pulling this all together. We were all always nervous about having virtual, and she's pulled this off. I also, Krina, are you able to give your email so that if any of our listeners or participants have any additional questions, that they could feel free to write to you, Krina, and we will get answers for you. I also, Krina, are you able to give your email so that if any of our listeners or participants have any additional questions?
She had the YouTube streaming on the same time, Judy.
Okay, so Krina, just put it in a chat. I can just mention it now. Krina's email is Krina, Krina, .shah, SHAH, at nyumc.org. That's krina.shah at nyumc.org. And we'll make sure that we answer all of your questions. Okay, thank you very much. Sorry to keep you over, but your questions were amazing. Thank you so much, Diana. Dr. Weitzman, Dr. Gordon, Dr. Thurston. I know Dr. Thurston has a meeting he has to run off to. And again, thank you very much. And if you enjoyed this, please like us. Okay, thank you. Bye-bye.
Bye now.
Okay, guys, so